It's another day with the physicians where your health is our business.
With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know
You're welcome back to the Planning Ultra of your regular program. Basic life support generally refers to the type of care that first responders, healthcare providers, and public safety professionals provide to anyone who is experiencing cardiac arrest, respiratory distress, or an obstructed airway. It requires knowledge and skills in cardiopulmonary resuscitation, also known as CPR, using automated external defibrillators and relieving airway obstructions in patients of every age. From our experts, you will learn more about basic life support, CPR, and how to provide them to those in need on today's episode of your regular program, The Physicians. It's another day with the physicians where your health is our business. Today we'll be talking about basic life supports and cardiopulmonary resuscitation, also known as CPR. My name is Dr. Martina Agbere, your regular host on this program. Of course, I'm not alone. I have my co-host with me. She is
Dr. Memuna Yusuf Kadri. Welcome on board. You know, all the time in the physicians, your health, of course, is our business.
I'll be talking about cardiopulmonary resuscitation and basic life support. I'm sure you know the reason why we had to do this.
Obviously.
The happenings recently, you remember somebody who was dancing and the man slumped. They thought he was actually doing acrobatic or like a fade, doing something.
No, that kind of dance step or something. Yeah.
And I watched that video.
Painfully,
and nobody actually knew something. Even the musician was saying something that maybe this is a new step. I hope this is not going to take him, something like that. And nobody it didn't even occur to anyone
that there
to
was
check.
A need that was an emergency, right? I watched that video over and over, wrote, for every step, every time the man wasn't attended to, for every second that was passing.
His life was going.
And that was so preventable.
They were still clapping.
People were just walking around nonchalantly. People were just, laughing and just thinking that was normal.
In that video, the man at a point actually jerked. He tried to even still stand up. So maybe that even made people think, maybe he's actually okay.
But I think what this just generally means that if you don't have the basic skills for CPR, go get it. And there's no age to it.
I think
it's 9-year-old saving the mom.
It's high time,
just because he could do CPR.
Anyway, CPR is very, very important. Basic life support is also very important. Do you have the skill? Do you know how to render it? In case of emergency, even if you are home alone, will you be able to save somebody's life? If you can't, and even if you can do that, don't go away. We'll be back after this time out. Just stay tuned. welcome back to your regular program, The Physicians, where your health is our business. Today we'll be talking about basic life support and cardiopulmonary resuscitation. And we have an expert in the studio. He is a medical doctor, a professional to the core. He is a lifesaver. He has taken this as a passion. He's actually the Chief Medical Director and CEO of Monitor Healthcare Limited. He's no other person than Dr. FEMI OGUNREMI. Doctor, you're welcome to our program.
Thank you so much for having me. Thank you. Thank you.
Lifesaver of our time.
Okay, so, and of course, he's also a practitioner, he's an educator. And how do you manage to cope with all these things? Well, you'll tell us in the course of the program. We're going to be talking about CPR and basic life support. So what is CPR and what is basic life support? What is the difference?
All right. So, I think before we even talk about CPR, talk about basic life support, we need to understand human being.
Yes. Yeah.
What we are. You're able to talk to me. We're able to do this conversation because you are breathing and your brain is having oxygen, is having the nutrients that it wants. So for any reason, if there's a shortage of blood supply to your brain or your brain doesn't have the nutrients it wants, then we can have this conversation. So if that system where you have the lungs, or let's say you take air in, goes to your lungs, from the lungs gets into your blood system, gets into the heart pumps to the other part of the body. If that system is abbreviated, then you go into a condition called cardiopulmonary arrest. The process of jump-starting this is what we call cardiopulmonary resuscitation. So a system that is arrested, you want to resuscitate it. So the cardio bit of it is the heart, pulmonary bit of it is the lungs. So the cardiopulmonary resuscitation is the combination of the two.
Wow. Awesome. So now that everybody that is watching us right now understand that from cardiopulmonary arrest, what you need to jumpstart it is cardiopulmonary resuscitation.
Exactly.
So how do you distinguish between that and basic life support? Because it sounds as if they are used interchangeably a lot of times.
Okay, so the basic life support is the cascade of everything that we have to do to actually get life back to normal. So the cardiopulmonary resuscitation is part of those things that you have to do for basic life support. So it's the support you give to somebody when they are down, when they collapse, to keep them alive until the advanced support is not. So, and this usually will happen on the field or somewhere outside the hospital.
Usually you talk about like 5, some say 5, some say 7 steps of CPR.
Okay.
Do you want to talk about that before you talk about the...
Okay, so okay, let's just talk about CPR.
Okay.
So CPR, like I said, is the cardiopulmonary resuscitation. So somebody is dropped down, they're collapsed at a very, very quick time, frame. It'll be very important for us to jumpstart the brain because your brain can survive for, let's say, between 4 and 6 minutes. After that, if there's no oxygen in the brain then goes into, then you go into brain death. And when this happens, it means that if somebody is at home, even on a normal day, to go from your house to the hospital will be longer than 6 minutes. And that's why we talk about it's important for people, general people or generalists or common people to be able to actually deliver CPR and then support somebody who is in collapse state until they get to the hospital. Now, the chain of survival, in fact, before we talk about chain of survival, let's talk about, the community system that is supposed to be in place, for the chain itself to be active.
Okay.
So we need to have a system whereby multiple people, different people can actually deliver the care. Now, the basic life support will then kick in when somebody is down. Somebody must be able to quickly identify that this happened. You must be able to quickly start, CPR, identify that the person is down, the person is collapsed, you start the CPR, and then you must know what you're doing with the CPR in terms of effective compression you're giving, where there's need for somebody to have, what we call rescue breath or breaths. You're able to deliver it very, very efficiently and quickly. And then, if they need to be defibrillated, because what happens in our heart is the pump, but this pump is actually supplied with what looks like tension. electric tension. So we're wired where you have electric tension both in the front and the back of the heart, and those are the things that stimulate the muscle of the heart, where the heart just pumps and relaxes. Okay, so this tension might fail. Okay, when there's a failure of the tension, the heart then just stops. And then there are different things that happens within the heart chamber at that time. The muscle might just they might be agitating, or they might just be, pumping in a way that is not coordinated, and then you can't have effective discharge of the content of the heart. And then when that happens, so such people who have failure of such supply, they might need to be how do I put it? We might need to shock them. So shocking them is what we call defibrillation. And what we do usually when we shock a heart is we actually kill the heart. Okay, it's temporarily. It's like somebody is not doing well, and then you just look at them and whack their head and say, "Do well," and then they reset them. So you whack the heart, and then you just get it into a stage where it just stops pumping, with the hope that will peak, and when it peaks, it reorganizes itself and then continue to pump again. We're supposed to have this thing so that if somebody collapses, we start the CPR, and then we're able to use the defibrillator, and then we can jumpstart people's heart. I can tell you practical example. I work in the UK, and I remember when I was still doing my training, and then I wanted to go and see the other senior, the registrar on the other side. As I was working, just to pass the reception, somebody just dropped. And then they went into a collapse state. And fortunately, I was there, started, compression. We took this guy in, shook, and then he needed to shock him. We shook him once. He came round straight away, just one shock, brought this guy back to life. Very young chap, 28 years old.
So timely intervention
very,
is
very important. And that's where the chain of, survival comes into play. We need a timely intervention. And all those components, the 4 components, 5 components, or 6 components that you're talking about, are the things that we need to all learn and to be able to deliver promptly as it's needed.
So what are the benefits? Because I know we are going to show the general public how this is done.
Yeah.
But before then, what are the benefits?
Okay, the benefits of this is when we talk about cardiopulmonary arrest, somebody is dying. So now, if we look at statistics, about 3 million people will die, I think annually, if I'm right. And then out of this number of people that will die, half of them would be alive, or 60% of them will be alive if we had actually been able to start a prompt, intervention, like just common basic life support.
Dr. OGUNREMI, you're doing very well, and when we come back, you will tell us the practical aspects on how to make people survive and save a life. Just relax. You're doing very well. Well, I'm sure you're enjoying what we're doing here, cardiopulmonary resuscitation and basic life support. Let's go out there and hear what we have to talk about on keeping up with the physicians. Our friends are out there. I'm sure you're going to laugh at a lot of the responses that they actually gave. We're back after the short break. Just stay tuned.
Yes, I've heard about it.
I have not.
I've heard of it before.
When somebody collapses and he needs to be resuscitated, somebody who has gone for the training we have to apply, what he has learned.
And people do not know what to do when somebody collapses.
No, I don't know anything about it.
Exhaustion could make somebody to collapse. Somebody doesn't have enough water in his system.
Stress, it can be maybe low sugar, it can be maybe dizziness and all that.
It could be high blood pressure, it could be heart failure, it could be... There are so many things that can lead to someone or one collapse.
I will use my phone to call the healthcare provider or health professional.
I can't really say what I will do. One, okay, now in this era of COVID, now I don't know if it's the COVID patient or not.
I'll call ambulance.
If that mouth to mouth can save life, I think it's nothing bad.
If you are just joining us, you are on to your regular program, The Physicians, where your health is our business. We'll be talking about basic life support and cardiopulmonary resuscitation. And we've learned that action, very quick action, prompts with confidence is required in performing this act. And Dr. OGUNREMI has been our host here. He is an expert on that field. But I want him to deep dive into talking about the choking.
Now, choking is it just means that there's an obstruction in the airway. So if you're choked, you can't talk. For instance, if I ask you to stop breathing and call my name, you can't. You can try it. Just stop breathing and call me.
It's not possible now.
Okay.
Let's go.
So you can't. So when we choke, what you notice is somebody can't talk actually. Yeah. So and that's what you use to assess whether this is serious. So when somebody can be saying,
yeah.
So if they do that, it shows that they're severely choked. Then you need to quickly help them. There are a couple of things that can be done. We can just, hold them in a position where they lean forward, and then you hit their back just like that. You do that like 5 times. Just what you're trying to do is to help them to cough. Okay, so if you do that 5 times, if they do not come round, or that doesn't come out, then you want to try and do what we call the abdominal thrust. So you put your heel just somewhere there, and then you hold them from behind like that, and then you can do that like 5 times to see whether they're going to cough it up. And then if they do not, you continue that you alternate it with another 5 back blow, and 5 of this, 5 of this, 5 of that, until they dislodge it. Or unfortunately some people don't and they pass out. If they pass out, then you have to start CPR. And then continue CPR.
And CPR with the thing that is choking come out?
Oh yeah. No. You do CPR because if they pass out, means that they're going to die in your hand.
Yes.
So you don't want them to die, then you start CPR.
It's good for us now with your good demonstration on helping anyone that is choking, and if the person eventually passes out, for us to see these practical steps on, on CPR.
Yeah, so we're going to do a quick one. Let's say I've gone into a toilet, for instance. I found this man on the floor and he's passed out. I don't know. A lot of people can just sleep. Some people drink and then they're unconscious. So you want to be sure they're not like they're sleeping. So you want to check. Are they alert? Hello, you call them. Hello, can you hear me? Hello, can you hear me? So you shout in their ears whether they're going to hear you. They do not hear you, then you want to check whether they're actually breathing. And then you listen. You look, listen, and feel. So you're looking at the abdomen, you're listening, and whether there's any sound, you're feeling whether they're breathing. And then you do that for 10 seconds. 1, 2, and 3, and 4, and 5. So you count that for about 10 seconds. If they're not breathing, then it's established that this person is collapsed. So if they're collapsed, you want to quickly look for help. There are 2 things here. It might be that somebody you just found them here. So if you just find them, you don't know how long they're there for. I told you earlier, on 4 to 6 minutes is the golden time. Yeah. So whether they've been falling, or maybe they've been down for like 4 minutes, and then you want to rush out for 5 minutes to go and get help. By the time you come back, they're dead, brain dead. So if you're meeting them right there, okay, you want to start chest compression. You give them, cardiopulmonary resuscitation for about 2 minutes. Give them that benefit of doubt, and then after that, then you rush out and call for help. And these days we have a mobile phone. You can actually call somebody on your phone. Just anyhow you want to get somebody to come, whether it's Mama Said behind or Mama Chinedu around the corner. Just call somebody to give you, because if you continue to resuscitate somebody on your own, you'll be there to forever. If they don't come around, there's no hand you can fall on. So you need to call somebody. So once the help is coming, always ask them if they have AED. They should bring the AED as well. Okay. Then straight away you're going on this chest. Okay. Chest compression is the key thing. And to do the compression, you look at the center of the chest. You put your hand at the center of the chest. And then you start, effective compression. When I'm doing this effectively, you can see that turns gray. Yeah. Okay. So if it's not effective, an effective compression is one that you do about 100 to 120, compression at the depth of about 5 to 6 centimeters. If it's an adult, the children one, differs. At least you're looking at a third of the thickness of the abdomen. That's why how far you're going. And the idea is when you do that, you're pushing the blood out of the heart. It must be an effective one. If you're doing something like this and you're not pushing the blood out, you're killing the person more, because the blood will not circulate. And then you continue to do that. You do a 30 compression and you give them 2 rescue breaths. So you do 2 rescue breath, 30 compression, 2 rescue breath, 30 compression. However, the rescue breath, because of what is going on now, there's COVID, there's other respiratory disease, so you have to be careful. if you cannot, if you're in a position where you cannot do the mouth to mouth, just continue with this. You know, if you continue with effective one throughout the time that somebody will come, that's still very, very good, because we call that one hands-only resuscitation. You know, hands-only CPR. It's still very, very important. There are a few other things that we might need to do. You want to know the details, you might need to come for the training. Okay. So, but
with the compression, how many compressions are you expected to?
You do 30 compression and 2 rescue breaths.
Okay, if you want to do the rescue breath, how do you position the patient?
Okay, so to do the rescue breath, what you're doing, this is an artificial lung. You see this chest rise up if you do effectively. So you need to do the healthy chin lift, and then you take a deep breath. So the idea is you're discharging the content of your tummy into this person's mouth. So,
oh wow!
And you're looking, right?
It did. Look at the chest is up. Yeah.
If you're doing it rightly, you see the chest rises. But if it's not right, okay. If I do this now, because I've not tilted it, it can't. Air can't go in. Okay, and it's same. So this is just the mimicking human being.
So for how long are you expected to do this?
Okay, so normally,
give up.
Normally when you do chest compression, if you're a fit person, by the time you do 2 minutes, you're tired. That, in all honesty, so there must be a process. That's why you need help. Somebody to come and help you after 2 minutes. The downside to this is in Nigeria, our health system is skewed, and we always want to plead to our authority out there to try and see the basic thing, like we talk about ambulances and that is not available. So our own ambulance will be Baba Chinedu and Mama or Keke Napep. So but how do you do this thing on the Keke Napep
somebody
now?
Who is
so those are the challenges, and that's where the integrated approach I was trying to explain earlier on becomes very important. So everybody those people in the sphere of affair that can make a difference. I think it's really important because people are dying needlessly, no doubt about it, in this country.
So because we've quickly talked about the adult, and I know children are also watching, and people will be wondering what are the number of compression for children, and what do you need to do?
So for the children, it's also similar. You're doing 30 to 2, but if you have 2 people that will be doing the compression for children, you can do 15 to 2, depending. Okay. Yeah. Then the other thing is when you are doing the compression, you don't want to. I mean, the depth that you're doing. Like I said, you have to look at the thickness of their chest, and then a third of it is what you're going down for, so you don't crush you don't crack the rib or cause things. I mean, in cases like this, people will lose one rib or the other. It's not a problem. You can fix that one after they come around. That's the least of your headache anyway.
Yeah, I don't want to say it's just okay for companies to train people to knowing how to rescuing those that will need CPR. I think for every family is important that you have family members of age go and learn how to do the CPR. And
you see, you just touched on my heart there, really. Because what I feel we all need to do, all of us here, wherever you are, you're listening to me or watching, you all need to have this done. And when you know how to do it, you don't know it for yourself. It's for others. Yeah. We need somebody else to know how to do it, to help you. I say this to the doctors when I do it for them. It's not about you. So you must try and get other people to learn. And that's why I'm very open. I feel very, very happy when you invited me to come here.
Thank you very much, Dr. OGUNREMI. It's really nice having you on our program, The Physicians.
Pleasure.
And we're actually very excited because we always said it here that you can always be just a click away, you'll be one of our guests. Dr. OGUNREMI actually found us out on LinkedIn, right?
Yes.
And he just sent a mail and told us all about himself, and that's him here today, now enlightening the public.
Thank you very much. And of course, you can all know now, CPR, timely intervention, delivering it, with the right skills, you are saving one life at a time. My name remains Dr. Memuna Yusuf.
Well, you heard it from him. He said taking the right action quickly and confidently can make the difference. On The Physicians, we always say your health is our business. Remember to follow us on our social media handles on YouTube, Instagram, Facebook, and of course, you can be part of this program. Just send us an email and you'll be part of us. Stay blessed. I remain Dr. Martina Agbere.
Hello, my name is Dr. Isiawe. I'm an endocrinologist and the medical director for Rainbow Specialist Medical Center, Lekki. You're watching The Physicians. Make sure you stay tuned, follow them on YouTube and all the social media handles.
But it can be so bad when you start feeling hopeless, worthless, and helpless. Yes. So those are the times when you start feeling suicidal, and that's when you start thinking, oh, this world is not, worth it. I want to kill myself.